Acetazolamide 500 mg solution for injection. Carbonic anhydrase inhibitors is a medication used to treat high pressure inside the eye caused by certain types of glaucoma. It belongs to a class of drugs known as carbonic anhydrase inhibitors and works by reducing the production of fluid inside the eye. It can also help decrease the buildup of body fluids caused by heart failure or certain medications. However, it's important to note that acetazolamide may become less effective over time, so it is typically used for a short period. Additionally, it has been used in combination with other medications to treat certain types of seizures, such as petit mal and unlocalized seizures. The dosage and timing for taking this medication should be determined by your healthcare provider, and it is important to follow their instructions carefully. This medication is administered through a vein by a healthcare professional, following your doctor's instructions, typically 1 to 4 times a day. If you take this medication too close to bedtime, you may need to wake up to urinate. It is recommended to use this medication at least 4 hours before going to bed. The dosage is determined by your medical condition and how you respond to the treatment. Make sure to drink plenty of fluids, unless your doctor advises otherwise. Use this medication regularly to experience its maximum benefits. To help you remember, take it at the same time each day. Do not increase your dosage or use this medication more frequently or for a longer period than prescribed. Doing so will not improve your condition any faster, and it will increase your risk of experiencing side effects. Inform your doctor if your condition persists or worsens. As with any medication, there are some potential side effects to be aware of. These can include dizziness, lightheadedness, increased urination, blurred vision, dry mouth, drowsiness, loss of appetite, nausea, vomiting, diarrhea, changes in taste, tingling of the hands or feet, hearing loss, ringing in the ears, unusual tiredness, easy bleeding or bruising, fast or irregular heartbeat, muscle cramps or pain, new or worsening eye pain, decrease in vision, mental or mood changes, signs of liver or kidney problems, signs of infection, and allergic reactions such as rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any of these side effects, it's important to notify your doctor or pharmacist. However, it's essential to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks for you. Many people using this medication do not experience serious side effects. To minimize the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. If you have any concerns or questions about the side effects of this medication, don't hesitate to discuss them with your doctor or pharmacist. And as always, if you notice any effects not mentioned here, it's important to contact your healthcare provider. Before using acetazolamide, it's important to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to talk to your doctor about your medical history before using this medication, especially if you have adrenal gland problems, untreated mineral imbalance, dehydration, kidney disease, liver disease, breathing problems, diabetes, gout, or an overactive thyroid. Acetazolamide may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can make these side effects worse. It's also important to avoid activities that require alertness or clear vision until you can do them safely. If you're using marijuana, it's important to talk to your doctor. This medication may also affect your blood sugar levels, causing them to rise or fall. It's important to monitor your blood sugar regularly and discuss any changes with your doctor. If you experience symptoms of high or low blood sugar, it's important to seek medical attention. Acetazolamide may also make you more sensitive to the sun, so it's important to limit your time in the sun and use sunscreen and protective clothing when outdoors. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications and products you use. It's also important to note that older adults may be more sensitive to the effects of this medication, especially dizziness and lightheadedness. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. If you are breastfeeding, it's important to consult your doctor before using this medication. When taking acetazolamide 500 mg solution for injection, it's important to be aware of any potential interactions with other drugs. Always keep a list of all the medications you are taking and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Some products that may interact with this drug include lithium, memantine, methenamine, orlistat, and certain drugs used to treat seizures such as topiramate and zonisamide. It's important to check the labels on all your medicines, as some may contain aspirin or aspirin-like drugs, salicylates, which can cause serious side effects if taken in large doses with this medication. If you are taking low-dose aspirin for heart attack or stroke prevention, make sure to continue taking it unless your doctor instructs you otherwise. Additionally, some products may contain ingredients that could worsen your swelling. It's important to inform your pharmacist of all the products you are using and ask for guidance on how to use them safely, especially NSAIDs such as ibuprofen or naproxen. Lastly, this medication may interfere with certain lab tests, potentially causing false results. It's important to inform all your healthcare providers that you are taking this drug. If someone takes too much acetazolamide 500 mg solution for injection carbonic anhydrase inhibitors and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. During the use of acetazolamide 500 mg solution for injection, you may be required to undergo various lab and medical tests to monitor your overall health and the effect of the medication on your body. These tests may include a complete blood count, checking potassium and sodium levels in your blood, as well as liver function tests. It is important to attend all scheduled medical and lab appointments as recommended by your doctor to ensure the safe and effective use of this medication. If you have any concerns or need more details about these tests, make sure to consult your doctor for further information. Make sure to take each dose of acetazolamide 500 mg solution for injection carbonic anhydrase inhibitors at the scheduled time. If you happen to miss a dose, it is important to consult your doctor or pharmacist to establish a new dosing schedule. This medication is typically administered in a medical setting, such as a hospital or clinic, and is not meant to be stored at home. It is important to follow the dosage and timing recommendations provided by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.